So, Bob, welcome back to the podcast. It's been a while.
It's been a long while.
People have been requesting that you come back. They emailed me. They're like, "Where's Bob?"
Wow, that's very surprising to hear. Very nice to hear. Thank you.
It's not surprising at all, Bob. Everyone loves you. Can you think of a single person who doesn't love you in real life?
Yeah, I can. Is that today's topic?
Well, I can't think of anyone who doesn't like you, honestly. This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I'm a therapist and a professor. Who are you, Bob?
I am your good old friend from graduate school way back when and a counselor in town here in Seattle.
My first question is, are you wearing that Penn State sweatshirt just to rub it in my face about the bowl game with UW?
I didn't think about that, but now that you mention it, that's just a side benefit. No, I wear this every Saturday.
We bet on that game, and you won. We bet my old IOU.
Yeah, your framed IOU, and now I have another one. I'm going to have to take that frame apart and add to it. $12, folks. $12.
So this will be relevant later, but Bob and I used to play cards and gamble all the time, and we would sometimes run out of cash to pay our debts at the end of the night. And so we would just give each other IOUs. We called them markers. And I don't know how long ago I gave you a marker and you kept it. You were always notorious for holding on to markers for years.
Oh, I kept them in my wallet.
Yeah. Oh, really?
Yeah.
And then you framed a marker that I gave you one night.
That's right.
And you put it on the line during the bowl game between UW and Penn State college football. And it was miserable. We lost. It was a close game.
Yeah.
But and then I gave you another IOU.
Yeah, for $6.
So you had some questions before I started pressing record. What were those questions?
How'd you score an interview with Irvin Yalom?
Yeah, well, a listener emailed me and said, you should have Irvin Yalom on your show. And I was like, that's ridiculous. He would never be on my show. And the emailer said, well, give it a try. And I did. And then he replied, and then it happened. And I was not, expecting that.
Wow.
Yeah.
How was it?
It was interesting. On one level, it was amazing to talk with him because, I've seen documentaries, obviously read his books.
Yeah.
I've seen interviews and stuff, but it's a whole different thing when it's you and him interacting,
Yeah.
And he's pretty good with, it's Zoom, not Skype.
Oh.
I hate Skype. Zoom is the new Skype, and so I'm Zooming with him.
Right.
And he's pretty good with it because he would sit real close to his laptop so that his face was my entire, and I have a huge computer screen,
right.
And so it was like he was right there with me.
Nice.
And so it was really interesting, and I feel how when I went to Freud's house in London,
right?
His second house, in London. He obviously grew up in Vienna, but
right.
I felt like I had touched the sacred, right?
Yeah.
And talking with Yellin, I feel the same way.
I couldn't agree more.
Right?
Yeah.
Not only him, with all of his... I mean, can you think of another more prominent therapist who's alive today?
No. And to be honest with you, if I could have therapy with anybody in the world, I'd go see him.
He's still practicing.
Well.
And I think he does online now too. I think he does over Zoom.
No kidding.
Yeah. Well, he's on Talkspace is like one of the major online therapy outfits.
Right.
That has been a sponsor of our show. And he's he's involved with them now.
No kidding.
Yeah. So he wrote about it in his memoir about how for decades he thought distance therapy was ridiculous. I mean, for him, he's Mr. Humanistic, existential. And so he just thought there's no way that's going to work. But in the last few years, somehow he came around to it. And now he's actually working with a former student of mine who is working for Talkspace to help them train their therapist, essentially, to do online therapy.
Really?
Yeah. Which the majority of Talkspace therapy is text-based, meaning just like a text, meaning that you send a text to your therapist and a couple hours later your therapist sends a text back, which is the most it's the furthest from in-office therapy you can get, I think.
Yeah.
Aside from like maybe smoke signals or something, I don't know. But it's interesting to see that, in his 80s, he's still open-minded.
That's amazing.
So not only him, but he has been heavily involved with other major figures. He was heavily involved with Rollo May. He was there when he died. He was heavily involved with Viktor Frankl, Virginia Satir, Mnuchin, Don Jackson, Gregory Bateson. Who else? There's Carl Rogers. I mean, he was there. He was contributing, to all that.
Yeah.
And sought out to meet these people. And so not only he is prominent and amazing and a major figure in our field, but the people he's met. So I feel like I am now, 1 degree away from people like Viktor Frankl and Rollo May and Virginia Satir and Salvador Mnuchin, and it's just like, and countless other people that he worked with. It makes me feel like, our field is. I feel like after meeting him, it shrunk the field down to me. Mm-hmm. It's like, these are humans who lived in real life,
right?
And I am not that far away from that. They're regular human beings,
right?
So there's that. I mean, what's your relationship with Yellin?
Oh well. When I was right out of college, I read Love's Executioner. And it's funny because that was the second time I read it. And the first time I was like, and the second time I was like, I really got it. I don't know if I really got it. I really loved it. So I wrote him and I said, great book. Where should I go to grad school? And this is me. I'm living in Pennsylvania, right?
So this is like early 90s.
Yeah, this is 1991 or 2. And he wrote back and said thank you for the compliment. And then suggested 2 schools in the Bay Area, both of which I applied to in 92 for the 93 school year and got into neither, which at the time I thought, that's a bad thing, but it actually ended up being okay. Like the way my work life has gone is fine. I don't feel disappointed in that.
Was one Saybrook?
No, California School of Professional Psychology in Alameda and the Wright Institute, which I really wanted to get into the Wright Institute. That was a really cool place. Folks, just a little note for those of you who are grad school bound, don't swear during your interview.
Is that what you did?
Yeah.
What'd you do?
I just got nervous and I, fuck this and shit that and blah, 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 blah. And, it's like Are you
sure that's why you didn't get in though?
No, yes, actually I am, because I spoke to the admissions person and she's like, great scores. You look great on paper. Great, essay. What happened at your interview? And what happened is I got flustered because the questions that the fellow was asking me were the things I wrote about. And I didn't know how to respond. And I got sort of irritated, but really just thrown off. And I should have just answered his questions directly. And I didn't. I just got nervous. So anyways, I didn't get into graduate school.
Meaning that you thought, haven't you read my paper?
Yeah.
Or I don't want to repeat myself because you've already...
Both of those.
Okay.
Yeah. Because if you did read it and I'm repeating myself, I should have just repeated myself, and maybe he didn't read it.
Right. I'm involved in that process at the university. And 1, we don't have time to read everyone's admissions papers. And 2, if we did read it, we probably skimmed it and it might not have been right before we talked to you.
Right.
You know what I mean? Because, there's dozens and dozens of these applicants. So it could have been that too.
I'm sure it could have been, and I didn't understand any of that at the time. I was very young. So about 10 years later, Yellin came to Seattle and was given a talk. There's a bunch of them.
You moved to Seattle
92.
Oh, okay. Why did you move to Seattle?
My brother was in the Coast Guard, got stationed here, and invited me to come with him. And I was tired of what I was doing in Pennsylvania, so I moved out here.
Okay.
Yeah. So early 2000s. No. Yeah, we were out of school by then.
Yeah.
He came to town and...
Well, so you're skipping, and people should know, by 95, you actually went to Antioch.
Yeah, that's when I went to school and met you.
And that's when we met, yeah. Anyway.
Right.
So, and then Love's Executioner was an assigned book, I think, in our first quarter.
It was.
Yeah.
Yeah.
So book. Love's Executioner, for those out there, it's a book, I think it has 10 chapters. I have it right over here.
Yeah.
But I think it has like 10 chapters, each on a different client that he worked with.
Right.
And he talks about meeting them and their issues and his own process. That was the most interesting part about it, was just how self-disclosing he was and how human he was.
Yeah.
He would talk about how some clients would bore him or upset him or make him feel inadequate or make him angry or, just various different kinds of reactions he would have.
Yeah.
And in my first quarter as a 24-year-old, douchebag.
Well, easy.
I was blown away. I just thought, like, the permission that Irvin Yalom gave me to be a human was very notable.
He's the best.
Yeah.
Yeah. So when he came to town, I was going to this talk. It's like 500 people in a room, and he's giving a talk. And he actually said, people still ask me if I practice. He was in his 70s then. So how old is he now? Do you know?
Was in his 80s, so he must early 70s. Yeah.
Maybe, it must be. Yeah. So he walked through the lobby and went to the the cafe in the hotel to have breakfast. So I went up to him and I'm like, my name's Bob, and I wrote you this letter, and do you remember me? And he just kind of laughed. He said, well, I get a lot of mail. But he was very gracious, and he signed my book, and just a lovely guy.
Which book?
Love's Execution.
Oh, okay.
Though have you read his fiction?
No, but I saw his movie that was based. That they made a movie out of When Nietzsche Wept.
They did?
Yeah.
What's it called?
When Nietzsche Wept, and it came out like 10 years ago. And it's like a major production. It has like people you would recognize in it.
Do you remember who?
I can't remember.
Yeah,
but
it doesn't matter.
But
I didn't see it.
Yeah, I'd be curious have you read that one?
Oh yeah, I read both of his novels.
Yeah, I'd be curious.
He might have 3. I've read 2 of them.
Yeah. So yeah, I'd recommend checking that out.
Yeah.
Last year, a couple years ago, a documentary was made about him too, called Yalom's Cure.
No, I didn't know that.
Which is interesting to watch.
Yeah.
It's interesting kind of look into his life. And then he just published Becoming Myself.
Nice.
Which is his memoir.
Right.
And I'm assuming you haven't read that one yet.
No, I have not.
So it's a great book, and that's just the current thing that he's trying to plug around. And it's basically like 30 small chapters about different topics. So it's, like about his mom or his dad or his sister or going to Vienna or Viktor Frankl or,
personal.
Family. Yeah, just little, very personal.
Oh, yeah.
I mean, there's so much information. It moves real fast.
Yeah.
He doesn't really go into that much depth, but that makes it really easy to read because it's just very breezy reading, And if you're in the field, like I've been saying, it's like he's been connected to so many people and so many things. And I didn't realize how many people he was actually connected to. And he glances over things. Like one sentence, he talks about taking a Friday all-day class about family therapy with Virginia Satir for like a year or something, and then that's all he talks about. Like he doesn't go into anything more about Virginia Satir, and you're just like, tell me more about that,
Yeah.
And there's just all these things that he experienced, and he moved around a lot, and he lived in Hawaii. He worked for the Army. He was a psychiatrist in the Army in the early days, and he was in Hawaii for a few years, and then he was at Stanford, and then he lived in London, I think, for a while, and then he traveled to Vienna, and he likes to go to places, again. So meeting him and reading his book, it's like, oh, he's a human being. That was one of the things. He even has a chapter on how people idealize him. Yeah, there's a whole chapter on like, it's interesting that you get idealized. People come to me and da-da-da, and he's just like, I don't, it doesn't really make any sense to do that. And so that was kind of an interesting thing. The other thing I'll say is that I thought by touching the sacred that he would solve all my problems.
Oh, how'd it go?
It didn't solve my problems.
Did it get any of them?
It furthered my problems, let's put it that way. The journey. And didn't make them worse by any means, but talking with him, I had so much ridiculous idealized expectations about what it would mean to talk with him.
Right.
And of course, he's a human being,
Right.
and he's not, even if he is as amazing as I think he is, he's not going to pour it all into a half an hour Zoom conversation.
Yeah.
You know, and so it was It was I had a mixture of emotions after talking with him, I'll say, and I want to talk with him more. And so I'm going to see I have a lot more questions. I want to talk. So in his memoir, he talks about how Viktor Frankl was a narcissistic jerk.
Oh.
And insecure, like really insecure.
Oh.
But then in the end, he's like, but his work was really important to the field, and I love it. But he talks for like a few pages about his experiences with Viktor Frankl, and it does not paint him in a good light. Not only was he in, so like one example was Viktor Frankl was writing a manuscript and sent it to Irvin Yalom to review. And there's this one section in there that talks about that Viktor Frankl was writing about how people were, he was giving a talk and the audience gave him 5 standing ovations. And he wrote about that explicitly in his book. And Irvin Yalom was like, that comes across as kind of narcissistic, a little braggy, you know. And actually, I couldn't stop thinking about how your reaction to my book. I don't think you ever had that. In fact, you had the opposite reaction to my book in certain sections. You were like, you're beating yourself up too much. You're just like, you're being too hard on yourself here. Like,
if you use that word humble one more time, I'm gonna scream.
Yeah, and you would write that. You'd be like, humble. Anyway, so Irvin Yalom's like, well, how do I give this feedback to the great Viktor Frankl that this passage doesn't come across very well?
Right.
And he did it gingerly, but he said something. And Viktor Frankl called him and said, or something, communicated to him somehow and said something like, well, Irv, you don't understand. I got 5 standing ovations. So I don't know what are you saying? Like, he didn't get it at all. Like it just, the notion that saying such a thing doesn't come across well was completely lost in Viktor Frankl, which is, and then there are other kinds of, like, he invited him out to Stanford to give a talk, and something happened where Viktor Frankl ended up coming across really badly to the audience, and somehow I think he even did a demonstration on stage with a fake client and actually harmed the person on stage, and like someone walked out of the room and said, like, I'm not going to stand by and watch this abuse happen. Yeah. And Viktor Frankl was really upset afterwards, and upset at Irvin Yalom for like this happened, and Irvin was like, I don't know what, it's kind of all your fault, but like I don't know what to say, and I did invite you out here, and Americans, Californians, were a lot less revering of authority than people in Europe were at the time, especially in the 70s and stuff, and so Irvin Yalom was like, well, maybe that's a part of it, I don't know, but then and so yeah, there were other kinds of things like that with Viktor Frankl, but and that's just a couple pages, you know what I mean? The book, his memoir, Becoming Myself, has all sorts of stuff in there like that. Did
you read Frankl's book, Man's Search for Meaning?
Absolutely.
It's disappointing to hear this story.
It is. Totally.
And it also, it sort of like calls into question, what he wrote in his book, because he's not living it.
Right.
It's weird.
Yeah.
It's weird.
Yeah. Yeah, I mean, Viktor Frankl, I did a whole episode on him, and in the episode, I said something like, I would venture to say that of the books on therapists' shelves, Man's Search for Meaning is by far the most represented book.
Yeah, that makes sense.
I mean, I can't think of another book that everyone would have. And I mean, Irvin Yalom doesn't have books that are on. I mean, Irvin Yalom's books are on. I would venture to say everyone has an Irvin Yalom book on their shelf, but everyone has Man's Search for Meaning.
Yeah.
In fact, whenever I go into a therapist office, I'll look for it. I'll just be like, oh, there it is.
Litmus test.
Yeah. Just like, oh, yeah, there it is. It's sort of like whenever I go to a Mexican restaurant and they're playing, Spanish language music, I'm always waiting to hear the word corazon.
No, I don't know that. Is that
Spanish speakers out there listening? Can you please let me know if you've noticed that, because corazon is heart, and it rhymes really well, I think, with a lot of different words.
Oh.
It's sort of like in American music, baby or love. Like you'll hear amor a lot in Spanish language music. But like I'll just be eating my nachos at Cactus downtown, which is a restaurant downtown, and then all of us, and I won't be really listening intently to this Spanish language song that I've never heard, but then all of a sudden, corazon will just ring out true. So my point is that Man's Search for Meaning is the corazon of music, or of books. So would you like to touch me that well, you've met him too, so you've actually met him in person.
Yeah.
So I guess we could touch each other.
Over his eggs.
I mean, what was your impression of him when you met him?
Well, not much of an impression when he was sitting there having breakfast, except he was very gracious with me. I was interrupting his meal. But I remember really liking him as he talked about whatever. I don't even remember what he talked about that day. But I just remember thinking, he's the real deal. He's like a regular guy, and as similar to the way he is in his writing.
Right.
I liked him.
Yeah, so I thought so too. I was like, it sort of contextualizes his writing so much more for me because he's kind of just a soft-spoken, nice, non-intellectual. Like he didn't come across to me as an intellectual.
Yeah.
He came across to me like just a regular guy.
Yeah. Right.
And someone who doesn't know things the same way that I don't know things.
Yeah.
And didn't have any special answers to anything.
Right.
And didn't reassure me, or there was nothing that he said where I was like, oh, golden nugget of wisdom,
Yeah.
Because of course, why? If he's a regular person.
That's what I like about him.
Right. Whereas someone like Viktor Frankl might have like a golden egg of wisdom for you. He would look you right in the eye and say something like "don't," Whereas with Irvin, he's just humble. He's just like, well, I don't know. And he said that a lot. He's just like, well, I don't know how to answer that one. So it was great. Anyway.
Are you going to publish the meeting?
Yeah.
Yeah.
Yeah. So this talk might come out after that.
Makes sense that it would.
Yeah. So, yeah. It's funny because the last thing I'll say is I've been telling various people about that I was going to talk to him, or that I have talked to him. And I get, one of two reactions. One is just like, huh? And the other one is like, oh my God. Yeah. Like I see people either flip the F out, or they're just like, they don't care. Yeah. Even people in the field, there's people, I guess younger therapists don't really understand. Maybe they don't know them. Maybe they don't know them or something. But I was talking with some therapists, some younger people. That was like, oh, I don't care. But I told Rebecca Bloom, and I tell you, and I tell other people, and they're flipping out to the extent that I would be flipping out if someone I knew was going to interview them. But anyway.
Hey, I wanted to ask you one question.
Yeah.
Is his group therapy textbook still like the textbook, or?
Yeah, and he's working on a 6th edition.
Jeez Louise.
Yeah. I mean, I have it right here too. Yeah. Well, I don't teach group therapy. I assume. Corey has a book. Corey's one.
Gerald Corey.
Yeah, has a book on group therapy too. Yeah. But yeah, I'm pretty sure the Corey book and the Yellin book are the main books, right?
Yeah. I don't know. It's been so long since I was a student.
The Corey book is more of a summary of all the theories, and Irvin Yalom's book is more of a direct, model and recommendation. And it's huge. Like you look at his books, it's like 3 times as long as the rest of his books.
It's enormous.
Yeah, and it's interesting. He talked about in the interview how there was a point in time in his career in the 60s when he was equally in love with family therapy and group therapy. And
I didn't know he did family therapy.
Well, he was being taught by Virginia Satir,
right? You said that,
and was involved in the Mental Research Institute, which was the epicenter of family therapy in Palo Alto, which is where he lives right now. So he was, right there, and he had colleagues back then who only did family therapy, which Anyway, so that was interesting. It's just like, how interesting would it have been if he would have published his first books on family therapy?
Right.
You know, it would have been so interesting.
Right.
But one thing he writes about in his memoir was, you know, at the time, 60s, 70s, family therapy was this new model, and people were so excited about it that some therapists, that's all they did.
Mm-hmm.
They refused to see individuals.
Oh, uh-huh.
It wasn't just something they did with some clients, you know?
No, everybody.
Everyone.
You call them up for therapy, and they say, "Yeah, bring your family." Well,
Bring everyone in your house.
yeah.
Yeah. And that doesn't happen anymore.
What do you think about that?
It bums me out. One, because the main thing that bums me out is that I am, as a supervisor and an educator, I am constantly beating my head against the wall with my trainees regarding, you're a family therapist. At least try family therapy sometimes. I'm exaggerating because some people are obviously hip to it. But people in agencies, you know, their internships, they go to internship, and the way that agencies work, it's basically, and the way that, because it's all based on funding, right? So the state and the county give money to these agencies to provide therapy for these people, and the people get therapy for free at these agencies.
Right.
And the interns do this work. And the state, everything is based on a individual client
Right.
diagnosis.
Like an identified patient kind of thing.
Right. And so they don't, and sometimes they don't even pay for family therapy.
Mm-hmm.
They do, but at any rate, the client is the 14-year-old who happens to be exhibiting the family system symptom. And so, and then the supervisors kind of get in on that, even though many of them might be family therapists themselves. The funders, all the languaging, all the files, all the paperwork, all the on-site training and everything. And then I'm talking with the interns or the supervisees, and I'm like, so, what's your involvement with the parents? And they're like, oh yeah, I meet with the parents sometimes. But my client, I'm like, no. The parents are the client, and the kid are the client. Everyone's the client. You're a family therapist, you know. I don't say it like that because that's a dickish way to say it, but it's close to that, honestly, because it's you're in a marriage and family therapy program, but I'm not frustrated at the trainees because, of course, they're just trying to survive.
Right.
And I'm just frustrated at the system and the way that this whole thing goes down, and that I have to basically, I feel like I'm beating something into people's heads that they don't want to be beat into their head, because they go into the agencies and they don't get that there. And in order to do what I'm telling them to do, they basically have to risk getting in trouble. You know, I talk with people and they're like, well, I don't know if my supervisor will let me meet with the mother individually. You know, because in family therapy, there are times, you know, to me, it's so obvious. It sounds it's such a stupid thing to say out loud, but if a 5-year-old has problems, it makes sense to meet alone with the parents sometimes, right?
Yeah, it does.
To talk about parenting at the very least,
right?
And really, what's the home life like? What traumas have the parents been through? What sort of projective identifications are the parents involving with their own children? What kind of transferences do the parents have? We'll say at least a factor, you know, if not the factor, especially when you're talking about 5-year-olds, you know, but really any kid of any age. And I'm talking to a supervisee, and they're like, well, my on-site supervisor won't let me meet alone with the parents. They're not going to let me do that. And I'm just like, and I know that it doesn't matter to the funding. They'll still get paid. So it's some sort of philosophical thing that some agencies have. Like, they'll say like, well, we have a family therapy department that's somewhere else. And I'm like, you know, you're not paying the intern anything. So it's no skin off your back. You're getting paid for the hour because it's all based on tier systems and all that kind of stuff. So you're just doing it because you just have a disdain for our field, even though you're from our field. Do you know what I mean?
I do.
So that's bothersome. But then it's doubly bothersome because I hear about these stories from Irvin Yalom about how there were therapists that's all they did. It wasn't just something they did sometimes. It was what they did with every single client. Now, I would never go that far because there's absolutely usefulness to individual therapy. But to hear these stories of just the freedom and the dedication and this like, well, this is what we do. Because if you say that to clients, they'll go along with it. You're just like, well, this is what we do.
Yeah.
And you're okay, and then the benefits of being able to get everyone in the room and actually like get people talking and the flexibility and just all the potentials that can happen in a situation like that. That's how I feel about it.
Is it falling out of vogue?
Yeah. I mean, yeah.
Huh.
And what I would like to do, a friend of mine, or actually a colleague, actually a former student of mine, but now a colleague, Laura Matthews, and she got married, and I can't remember her new last name, but she wants to, something with the word Berry in it, Glenberry? Anyway, she wants to, she told me, maybe even on this podcast, that she wanted to start a family therapy institute in Seattle. And when I heard that, I was like, oh my God, why isn't there a family therapy institute in Seattle where you're the center for family therapy and you market yourself as that, and you inspire and you have a philosophy of family therapy, and you support family therapy efforts, and you have family therapy experts, and you advertise yourself as the family therapy place. Because honestly, where family therapy happens in Seattle are at places where they are at least slightly, if not greatly, hostile to family therapy.
Yeah.
So to have a place where it'd be like, there's eating disorder clinics. And imagine if, and there's a reason for that. It's because when you go to agencies and other kinds of clinics, they don't specialize in it. And I'm guessing, have situations where people go in with an eating disorder and they don't really get the help that they need, because you have people that are treating various different issues and they kind of know something about eating disorders. You know what I mean?
Yeah.
And so these eating disorder clinics pop up because you have a need for that. And it's just, and then to have her say, ooh, I'm going to start a family therapy institute. I'm just like, oh, yeah, we need that.
Yeah. It's both good news and bad news, isn't it? Like, we're in a position where we actually need that sort of thing. It's not just happening.
Right.
Yeah. But then again, if she starts it, it'll be happening.
Yeah. But I know she's also overwhelmed with a lot of things right now, so she probably won't do it. Maybe I should do it. I sometimes think about that. You used to run, you have a DBT group.
I do.
And were you kind of a landlord at one point?
Landlord? You mean like I owned a property?
Well, like you leased, you like subleased or something, didn't you?
We owned a townhouse and we leased it to, folks that were renting in Seattle. Yeah.
Oh, but not therapists.
Oh, no, there was a time when I was looking to buy a building and like, host a bunch of therapists in the same building.
In Wedgwood or Lake City or something.
Yeah, down there, Maple Leaf Way.
Yeah.
And that we didn't end up pursuing that.
Oh, okay. Would you ever start an institute?
No.
How come?
I'm at this point, I don't want to do more work. There's other things I want to spend my time on.
Totally.
And that actually is intimidating.
Totally.
Yeah.
Yeah. Yeah, I think about that sometimes, and then I just kicked his foot. I didn't just apologize for no reason. Although I'm sure it didn't actually hurt you, so I don't know why I'm apologizing. I take my apology back, Bob.
Very unhumble of you.
You and your foot can F off. All right, let's take a break, and when we get back, let's respond to some patron emails. What do you say?
Sounds good.
All right, we're back from the break. If you haven't become a patron of the podcast yet, do so now. Become a patron. Go to patreon.com. It's really the best way you can show your support for the podcast, and you actually also get a lot of benefits. All right, so anonymous patron writes, how does one get over the fear of talking in therapy? I've been seeing my therapist for 1.5 years, and we have an awesome relationship. But every time we talk about something important, I get scared, and the next sessions are spent in a great deal of silence. I feel like I'm wasting valuable session time. What do you think?
Well, that sounds really hard.
Yeah.
Because the thing I would suggest is talk about the fear, but that's a pretty tall order when you're already scared.
Right. Right. It's like, our common advice to stuff like this, well, let's just talk about it. But of course, it's a catch-22 because
Right.
if you can't talk about the easy things, it's going to be even harder to talk about this, right?
And yet, at the same time, this person has a golden opportunity. They have a good relationship with their therapist. So it sounds like that therapist is probably going to be open to hearing about this. And boy, what a rich mind. I mean, that person could, I'm just imagining the freedom that could come from taking the risk.
Yeah.
So totally. I hope you will. I think you'll be glad you did.
Yeah. 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 It's a tough one because of that catch-22, right?
Right.
I will say that it's a common issue. I've had issues like this with my own therapist. I would say it's actually a kind of a central issue to me in terms of, I mean, I can certainly keep a conversation going and I can certainly be vulnerable about some things with my therapist, but there are certain topics that it is so hard to open up.
Yeah.
You know, certain topics where you're just like, ugh, let's talk about this other thing.
Oh,
Have you ever ran into that before?
You mean personally?
Yeah.
Is this a trick question? I'm not
I don't know. You seem like the kind of guy where you would just lay it out on the line.
I do a fair amount of that, but there are things that I've never talked about.
Oh, really?
Yeah. But are they central to my welfare? It couldn't hurt probably, but they're probably not central. And I'm also not of the opinion that everything that's in me has to be, fair game for therapy. Yeah. I think it's okay to have some privacy.
But have you ever had this experience where you're just like struggling with vulnerability and then you kind of reel back after revealing too much because it felt unsafe somehow or something?
Oh, yeah.
Yeah.
Oh, yeah, very much. Not just in therapy, but in life.
Right.
Yeah.
Right. And so to that, I'll say it's totally okay to have that process. There's nothing wrong. It's a normal, healthy defense of not being hurt. There's a reason why we all don't just lay it all out there for everyone because some people aren't nice about stuff like that.
Yeah, I really like what you're saying. It's universal to be afraid.
Yeah.
Like we shouldn't think of this person who wrote in as having some kind of pathology.
Right.
That fear of vulnerability is universal.
Right. So yeah. And I would, so given the catch-22, of course, just being able to talk about it would be wonderful. But if you can't do that, what I would concentrate on is while you're talking about the small stuff with your therapist or doing whatever activity you do that is safer, you really concentrate on absorbing the safety of it all, just like focus intentionally on, okay, this person feels safe. We can talk about this. I want to talk about these other things, but I don't feel ready to do that. But in this mode, I can relax and I can feel safe and this person isn't hurting me. They've never hurt me. I'm not ready to talk about other stuff yet, but, The other thing, actually, now that I'm thinking about it, is that you might actually be bumping up against PTSD issues where, you're not explicitly saying this, patron, but it's possible that you're avoiding because of the tremendous pain and distress that emerges when you actually dive into particular topics.
Yeah.
So if that's the issue, then you actually don't want to go there until you have the setup in therapy for trauma therapy to be safe and paced well, if that makes any sense. But anyway, another email from another patron here about confidentiality. I was involved in a sexual misconduct case with a past therapist. It's over now, and I have a new therapist. I told my new therapist about the details of the sexual misconduct with the previous therapist, and this new therapist told people in her office building about my case. She told them about the case and additional details that are not public knowledge. She didn't mention my name, but she did mention the therapist's name. Was this unethical? I have not been able to find anything concrete about her right to do this. It has definitely affected the therapeutic relationship. We had previously discussed that I didn't want people to know about it. I can't control the media, but does a therapist have the right to do this? What do you think about this, Bob?
Oh, boy. I really want to sit with it for a bit. I feel bad for this person.
Yeah.
I could totally that must feel terrible.
Yeah.
It must just feel awful.
Yeah.
Can I trust this person? Plus, do these people know who I am?
Yeah.
You know, like so exposing or potentially exposing.
Yeah.
Ugh.
Yeah, totally exposing, because it's like you, sexual misconduct case. I'm just trying to like imagine what that would be. It's like I'm assuming that she had sex with her therapist or some kind of contact, and the patron ended up complaining, and it ended up becoming a public or a legal matter. And by definition, those are somewhat public. Mm-hmm. And the therapist may have lost his or her license or something.
Yeah.
And then she goes to another therapist and tells the details, because it's already exposing as it is, right? Yeah. And even though it shouldn't be, it's humiliating. And even though it shouldn't be, people are going to judge you about it, because you say you have sex with anyone, they're going to judge you about it as a slut or something. It's just so stupid. But so there's all that. But then you tell your therapist about some intimate details that really no one probably knew about it, Yeah. Maybe your ambivalence about the whole thing. Maybe you still have feelings for the person.
Sure.
Particular acts that you went through. I don't know.
Yeah.
And then your therapist turns around and tells all these other random people, and you're just thinking like, what? Like, why did you do that?
Sure.
And you don't know these other people. You don't. I mean, that's the thing to me, that even with people that have confidentiality, because technically speaking, these other therapists shouldn't be talking about the case, right? But you and I know that there's a percentage of people and a percentage of different stories that people are gonna talk about with other people, their spouses. And once you tell your spouse, they don't have any legal responsibility.
No.
And so and to me, it's like, even if it's just the colleagues that's violating, right? Just because they're therapists doesn't make you happy about the fact that they know, if any of our therapists randomly told a room of other therapists about it, just because they're therapists doesn't make us feel, oh, well, that's fine. They're therapists. It's like, we don't want anyone to know about this stuff. So yeah.
So I don't know if, I don't think it would be easy to ask the therapist next time you see him or her, to say that you knew, that you found out that they were disclosing, and to ask why they did that. Mm-hmm. But it seems like it's a reasonable thing. It's a reasonable thing to ask, and it might be. I don't know. I don't really want to have an opinion about this because we don't know any of the details.
Yeah,
but I could see not going back.
Yeah, totally. Yeah, my impression was that the new therapist actually told her that she told her colleagues.
Oh, is that right?
Yeah, that was my impression.
Huh.
Which is interesting,
What would be the reason for that?
Yeah, what would be the reason for any of it, honestly?
Yeah.
I mean, so again, we have no idea.
We don't know.
But I could imagine someone came to you as a client and told you that they had this, sexual relationship with their previous therapist.
Yeah.
And you're in a town and maybe even know that other therapist.
Sure.
If for me, I would be tempted to gossip about that. I'd be tempted to go to you and be like, so that thing that happened? Well, I'm actually seeing that woman. Mm-hmm. And she told me some things. Oh boy, was this guy, you thought the case was bad. Listen, I would be tempted to do that. Sure. Now I would refrain because I know better, but I'd be tempted. Would you be tempted?
Oh, I think most anybody would be.
Right. Tempted. So I think that's what happened. I think it's because I'm trying to think, again, we don't know the details, but so to go over the ethics, to answer your question, patron, are the circumstances have to be determined. So according to the ethical codes, and this is generalized across all professions, psychology, marriage and family therapy, counseling, is you can disclose information, client information in 4 different circumstances. Do you know the different circumstances?
I probably don't.
Well, you probably know some of them.
Well, in a case consultation, I would imagine that's one.
Right. Consultation. What else?
Wait, are we talking about like if there's a threat to life, that
right.
sort of thing?
So mandated reporting.
Yeah.
What else?
Subpoena. Oh, wait. It depends, though, because
We could for
could.
subpoena for legal reasons, yeah.
Okay.
And there's one more that actually HIPAA has.
Is that the Tarasoff one where?
No, it's still mandated reporting and all that kind of stuff. It's to assist treatment, and it's something that we don't actually do a lot, but medical people do. So,
right.
So when you go to your physician,
Right.
and you go also to a cardiologist, you don't necessarily need to assign an ROI for them to communicate even release of information, even though technically speaking, they don't have strict written authorization to communicate, but they're both treating you.
Yeah.
And it's in your best interest. And that was actually what HIPAA was designed for, was to allow people to do that.
Oh.
Yeah.
It's had this paradoxical effect.
Right.
Jeez.
Exactly. So HIPAA originally was designed in the 90s because physicians and medical professionals were finding it hard to communicate with each other.
Yeah.
And so they set up this federal law that, spanned across all states that allowed for, that defined it all very clearly so people could do it. But what it ended up doing was basically creating, or at least the way it's communicated to us or the way we take it is as limiting. But it actually is just, to some extent, it has more freedom.
Do you think in the medical world they experience it as freeing?
I don't know.
Yeah, I don't either.
I imagine it is because they work more closely with other people. We, and especially in private practice, we're so isolated and rarely have a reason to reach out,
Yeah.
So, but imagine you're a physician and you would have to get an ROI for every single other medical professional.
Oh, cumbersome.
Every time, it would be a pain in the ass.
And then they expire after 90 days and you got to,
right.
Who could do it?
Right. So the different circumstances are, one, to assist treatment, like talking to a client's physician. And this situation doesn't sound like that applies.
No.
The second situation is for safety reasons if someone's life is in danger. So this actually is sort of related to Tarasoff, but just a general thing of like, if someone's life is in danger, ethically speaking, you may disclose client information without their approval to other parties. You could still get sued for it potentially, but it would be a debatable situation. This doesn't sound like it's that situation.
You could get sued for not doing it too.
Right. Exactly. Yeah. Good point. Number 3 is when the law requires it, like when mandated reporting or a subpoena or something, and obviously it doesn't apply to that situation. And number 4 is the first one you said, is when consulting, and it's possible that that's what's happening. So,
Sure.
So if the therapist was consulting and saying something like, I have an interesting case and I would like your help, colleagues, and let me give you a little background, which requires disclosing some client information, then the disclosure is justified, particularly if the people that your new therapist told this information to are regular consultants. But even if they're kind of one-off consultants, it's still generally allowed. But if it's for gossip reasons and not consulting reasons, or the quote-unquote consultation doesn't really look like a consultation, like you're just in the break room, or you're having dinner together, or you're at a party or something and you disclosed it, like you're not in a staff meeting or something, then it would be hard to justify that that's consulting. Mm-hmm. So patron, if you're interested in, finding out about the legality, one thing you would do is just ask your therapist, why did you disclose this? And if the therapist says like, well, I don't know, I just thought it'd be interesting to tell people,
oh boy,
which would be hard to imagine a therapist saying.
Yeah.
But given the emails I get from people,
really?
I would not be surprised.
Oh.
So there's that. But if the therapist says, well, we have a regular consultation group where we meet once every couple of weeks, and in the course of all of us going around the room, your case came up, and then in that situation, it is an ethical thing. Now, having said that, given the fact that by disclosing, when you consult with colleagues, you're supposed to actually make a reasonable attempt to mask the identity of the client. There's no reason why you have to, like when I consult with other people and when my supervisees tell me about even their own clients, they don't tell me the names.
Yeah.
And I have access to those files if I want to look at it, but it's like, why risk it? I don't need to know the person's name.
Yeah.
What if I know that person, And so it's just easier. It's just like, don't tell me the name. Or don't tell me where they work, or if they're a famous person, don't tell me how they're famous.
Yeah.
Just leave all that out. It's not hard. So unless it's absolutely critical to the case,
which is a little hard to imagine,
right? So this therapist could have said, "I have a client who suffered from a sexual misconduct with a previous therapist," and honestly, I learned in ethics years ago that in a situation like that, because those cases are so public, you should actually lie to your consultants as a way of masking identity. So you'd say, it wasn't in this town, it was like in Chicago or something. Like you would lie and say, to throw people off the scent, because you don't want your consultants to know who you're talking about. Because what if they have a transgression and it harms you somehow, or they know you,
right.
Which is all, that's the other thing, you just never know if one of the people you're consulting with might know you, or know the therapist that had the complaint against, or liked that therapist, and then goes back. Oh my God! Like, what if that happened, right?
Yeah.
If one of these therapists knows the therapist who lost their license, like, ugh, right?
Yeah.
Yikes. So anyway, even if it was a consulting situation, you as a patron might still have a case if you wanted to say that you were harmed in some way, or the therapist didn't do enough to mask your identity. It'd be a hard complaint to win, but at the very least, you could talk to your therapist and say, I don't like what you did. I wish you would have asked me. Because that's another thing. I would have done this if I had her as a client. I'd be like, so I have a regular consultation group with a bunch of therapists, and your case might come up. And how do you feel about that? Given your situation, I don't know how you feel about that. Is that, is it something that you would like me not to do? Or because I don't want to, the thing is I never want to harm anyone. I never want to bother anyone. I don't want to consult about a client and then have that client go like, that hurt my feelings. I was just like, why do I want to do that? It's not important enough, right? So that's what I tell all my trainees is like, because there's all this talk about like, well, what kind of information can I disclose and stuff. It's like, well, just ask your client. Just ask them. Would you want to be asked? And they'll be like, yeah, I'd want to be asked. Well, then why aren't you asking your client? Just ask them if it's okay that you do this.
Right.
And if they're not okay, try to convince them of the benefits, try to belay their fears. And if that doesn't work, then don't do it. You know what I mean?
Yeah.
Anyway, but it appears this therapist did not do that. So you can ask your therapist about it. You can do what Bob says and actually just have a conversation with your therapist about it, and maybe even terminate as a result because you don't really feel safe, which, would make sense. If the person has a supervisor, you could obviously go then to them too. You can also go to the State Department of Licensing. You go to their professional ethics board. So if they're a licensed marriage and family therapist, or they're a psychologist, or they're a counselor, mental health counselor, or a licensed professional counselor, or a social worker, or a psychiatrist, or a psychiatric nurse, there's specific professional organizations that kind of oversee them. But at the very least, you can go to your state Department of Health. So what would you do if you were the client at this point?
That's a good question. I'd like to think that I would go and talk to my therapist and get information. Mm-hmm. But I don't know if I would.
What do you mean? What would you do otherwise?
It might feel too scary or irreparable that I might just bag it.
And quit?
Yeah.
Yeah.
I might.
Yeah.
I feel bad for this person. It's a really crappy spot.
Right, because I might do the same thing because I'm just like...
This person being the client.
Yeah.
Not the therapist.
Right, exactly.
Yeah.
Because it's like, well, they've already, if I felt violated enough, I'd be like, well, what's the point in having a conversation with them about it? Like, I'm just benefiting them, and I'm angry at them.
Yeah.
So I just have to do what's best for me, which is like terminate, find another therapist, and then tell them, look, by the way, I don't want you talking with anyone about this, even in consultation.
Right.
You know.
So if self-respect is enhanced by going and talking to the counselor, that makes sense.
Yeah.
Just by if it helps you to speak for yourself and say, I don't like this. I don't want you to do this, or I'm not going to see you anymore. And if self-respect is enhanced by taking that kind of stand, good on you.
If I liked my therapist, I would go to her and I would tell her how I felt. I would tell her to never do it again. I would tell her to don't even consult about me.
Yeah.
And I would tell her to tell her colleagues that they are to forget, or at the very least, not tell anyone about what they have heard.
Yeah.
And that you made a mistake by revealing all that information that you didn't need to reveal. I want you to apologize to me, and I want you to apologize, and I want you to tell everyone else that you made a mistake by telling information that you didn't need to be telling, that honestly is a little gossipy. If my therapist responded well to that, I would consider continuing with them.
Sure.
If they responded badly to that, if they were defensive, or if they were like, well, I can consult with whoever I want to, or I think you're a little upset, or whatever the bullshit, you know, I'm sorry that you were hurt by that, you know, that kind of bullshit. I would fire that person.
Yeah.
Because if I did that and a client came to me, I would be mortified. I mean, it brings tears to my eyes just thinking about like hurting a client in a vulnerable situation like that. You know, if a client came to me, I'd be like, I done fucked up. I should not have done that. Oh my God, you're right. Like, yeah, I'm sorry. Like, yeah, I will immediately go and tell everyone, and let me give you the names of those people who even know. And, you know, and they're respectable people, but I'll tell them for sure, like, keep this under wraps. And yeah, I'm really sorry for doing that. One, because it's the right thing to do. And two, because I make mistakes all the time. I don't have a problem with apologizing for them. And I value client feedback, you know, student feedback. When people give me feedback, I've been talking a lot lately about how YouTube comments have been bothering me because so many of them are just horrible.
You get YouTube for the podcast?
Yeah. For some reason, I started posting the podcast on YouTube years ago. I could go into the details, and you know, emails, people are normal. Emails, people are negative, but they speak in a more sort of relatable tone or something. People on YouTube, there are comments that are just so bizarre or so hostile or so short, you know, and so, I don't know, just so lacking in social skills. And YouTube, I think the culture is that. Even if you have social skills, I think the culture of commenting sort of drives you into this like lack of social skills kind of way of communicating. And or there's a bunch of 12-year-olds that just lack maturity, you know what I mean? And so I've been talking about that. So I've been wondering if the listeners are just like, man, Kirk is really sensitive to feedback. I'm sensitive to feedback like anyone else, maybe more so than other people, but I value being able to respond well to negative feedback.
Yeah.
When it's not hostile, unreasonably hostile, I will say. So when a client tells me something, I can immediately sense the tone from them. You know, I immediately like, oh, okay, they've just taken a massive leap, and they've been thinking about this for a while, and they're very vulnerable at this moment. And so I'm going to nail this. I'm going to be open. I'm not going to be defensive, and I'm going to hear this because I've been in their shoes before, and I know how this feels, you know?
Yeah.
Even if I'm like, I don't know if this is so like reasonable, I know enough to nail it. When a student, or a supervisee gives me negative feedback, again, I know that thing has been germinating for a while. And again, even if it seems unreasonable, particularly at the time, because I might be defensive,
Sure.
I will, there's this place in my routine, in my mind, where I go to, I'm like, no. Show them that they are safe and that they can tell you things and that you're open. You can argue about it sometime later, but in all likelihood, you won't need to. Just be a good listener and respond well to this. So, and as soon as I make that shift in my head, it usually makes it so easy to do it. It's just like, why fight it? Maybe they're wrong, maybe they're right. It doesn't really matter. It's important to listen and to respect people, and what a wonderful thing that they're doing. Because the other thing that I'm thinking is, like, if I show them that they can give me this feedback, our relationship is going to be twice as deep.
Yeah.
And if I don't, then the relationship might be over after that. and I want them to feel comfortable around me. So anyway, that's what I would do. Is I would lay it all out for your therapist, and if your therapist responds well, then I would consider continuing. And if the therapist doesn't respond well, then I'd be like, because one, fuck that person, and two, if you can't trust them, you have two major data points where you can't trust this person, and you need to be able to trust your therapist.
Yeah, it doesn't work if you've got that on your mind.
Right. All right. How about one more email?
Sounds good.
Anonymous patron. Have you ever had a client where they reminded you of somebody else? Has this ever impeded the therapy process in any way? Bob, what do you think?
I was with somebody last week who looks like my sister.
Yeah. Okay.
And it doesn't impede. It's a little distracting. But it's a come and go kind of thought.
Distracting how?
Well, because I'm starting to think about my sister, and my attention is a little split.
Yeah.
Yeah. But it's not, I wouldn't say that it impedes. It doesn't get in the way, and it doesn't last very long.
Have you ever, you've been practicing for 20 plus years.
Yeah.
Have you ever had someone that really reminded you of somebody? Someone important, like an ex or your dad or something?
No, countertransferential stuff comes up, and then just my own transference comes up. But I don't think I've had an experience like that.
Yeah. Interesting. Yeah. Well, to me, so you have two questions. Has a client ever reminded me of someone else? It really depends on what you mean by remind. Based on your email, because it was longer than this, I think what you mean, maybe more crucially, is really remind you of somebody. Like many aspects about them are similar to someone very important to you. Mm-hmm. Your spouse, for example. My God, this person looks like my spouse. They talk like my spouse. They have attitudes, values. I have a reaction to them as if they were my spouse. Mm-hmm. Like, I think that's what this patron is actually asking about.
Oh.
So, and you've never had that before.
I've not had that experience. I imagine that's distracting.
Yeah, I've never had that before either. I can imagine a couple times where I was like, oh, this is interesting. This person has an attitude or a sort of syndrome that is similar to someone important to me. Mm-hmm. I've definitely had that before, where I was like, this person has a syndrome or a complex that's similar to someone close to me. And in those situations, it is actually kind of interesting for me, because I'm like, this is an interesting window into that person in my life.
Well, oh, right.
You know what I mean? Yeah, because the person in my life, I'm not their therapist, and I'm reactive to and everything. My client is coming to me for help, and I have compassion for that person, and I'm not triggered by this client. So I'm seeing it more objectively.
Right.
And actually, those situations help me to understand people in my life better.
Yeah.
Because I look at the people in my life, and I'm like, I think I understand their problem. Because if someone close to you is annoying in some way, has some sort of issue that annoys me, and I can intellectually kind of get, well, it probably comes from some sort of complex of some kind. But it still fucking annoys me that they do that thing.
Yeah.
Yeah. But then you have a client with the exact same or a similar syndrome. It doesn't annoy me because they're a client and I have compassion. I can see it objectively, so to speak. And then I slowly over time have a more objective, compassionate view towards the person in my life, you know?
Yeah, nice.
But I don't think, now I will say that one time I remember one moment where I was probably like a couple minutes into a line of questioning with a client where I realized you're no longer treating this client. You're actually just trying to figure out the person in your life. You know what I mean?
Oh, wow.
Like I was asking questions for my own benefit to try to figure this complex out because I wanted to understand the person in my life, not that I wanted to treat my client. I don't think my client noticed. It was just a couple of minutes. But it was something I noticed. I was like, "Oh, don't like that's you're just curious about this syndrome now. You're not actually trying to treat this person."
It's a perfectly natural thing to have happen.
Yeah.
It's not something. I'm sure it's not something you love happening.
No.
What's great about it is you recognize, and you get back to business.
Right. Exactly. So patron, when you ask about remind, yeah, I've absolutely had people remind, like you said, like, well, I have someone who kind of looks like my sister.
Yeah.
Yeah, I mean, or someone who, I don't know, comes from a similar demographic as someone you know, or even of yourself or something, for sure.
Oh, that happens to me.
What?
My clients remind me of me frequently.
Yeah. Well, that's interesting. So that's not what the patron is asking about, right? But
No.
But that is answering the question. It's like, yeah, it reminds me of someone. Me. How does that go for you?
I really like it because for both reasons. One is it often gives me insight and compassion for myself and my own troubles in life.
Yeah.
But also my own self-awareness will often help me, inform me about what might be happening for this person in front of me and how they might be suffering or, not getting their needs met or scared or whatever. Mm-hmm. And I like that. Mm-hmm. And I'm fairly disclosing as a counselor. Like, I don't it's not my session, but I do like to be, I'd like to think I were a little like Irv.
Right.
And a real person.
Right. Yeah. And so you might say like, oh, well, you kind of remind me of myself, blah, blah, blah.
Yeah. Sometimes they'll say, oh yeah, you and I have chewed the same dirt.
Chewing the same dirt?
We've chewed the same dirt.
We have chewed the same dirt. Interesting. Did you ever eat dirt as a kid?
No, never did.
You didn't grow up in the woods.
No, suburban Philadelphia.
Yeah. I grew up in the woods, and so there's a lot of daring each other to eat things.
We had a friend down the street, Wooder Joe. His name was Walter Joe, but we called him Wooder Joe because everybody in Philadelphia, they say water, they say Wooder. Wooder Joe. And he claimed to eat a mud pie, so we made him one. And he claimed to eat it, but, who knows? It was pretty big.
We would pay friends like $1 to eat a slug.
Oh, yeah, I did that for free once.
You ate a slug?
Several.
What? Oh, gnarly.
Yeah, I was sick for a few days, yeah.
You were sick for a few days.
Yeah. We were sitting in a river pitching them into each other's mouths.
Oh, my God. Was that just a temporary insanity, or did you have
It was 19 and drunk.
Oh. Well, still.
Yeah, right.
19. And like big ones or small
No,
ones?
they're little ones.
Little ones.
Little shells, though.
Oh, snails.
Yeah.
You ate the shell,
Yeah,
too.
it's just swallowed, yeah.
Oh, my. How did that come out?
Runny.
But wouldn't the shell stay intact?
Oh, I don't even know. I was so sick.
So you're talking about snails. Okay, for some reason, snails is like 5% the gross out factor, because I'm thinking like a slug.
Oh, slugs like they have out here?
Yeah.
Whoa.
Right?
Ugh.
Like a snail would be like, well,
They're little.
yeah. It's still disgusting.
Yeah.
But I've eaten escargot. That's the weird thing, is like escargot, it's good.
Give it a French name.
But you pull it's a slug you pull out of the shell.
Uh-huh.
You have those little forks.
Yeah.
And you pull an entire slug out of the shell and you eat it. And it's delicious. But if you just put like slugs on a plate without this, somehow the shell makes it more palatable.
Uh-huh.
I don't know.
No, I get that. That makes sense to me.
But yeah, so we would pay people $1 or $2. There'd usually some sort of bidding war, like, I'll give 50 cents. No, you got to give me $5. $5? No way. How about $2? $2.50. And I'm like, hey, do you got an extra 50 cents? To my other friend, he's like, yeah, sure, I'd do that for okay. $2.50. Eat that slug. And then there'd be this whole ramp up. It's like, okay. All right. Let me see the money. Okay. How about $5? No, $2.50. You said you were gonna do. Okay. All right. Okay. And like it was a whole thing, or a worm.
Were you on the eating end of that ever?
No.
Uh-huh.
No. I mean, I'm a Japanese, so I've eaten some disgusting things at home anyway. But there's something about just picking up something in the woods, like a slug, because the thing that. This is a gross thing to say out loud, but I would, when you're 6 or 7, you're still kind of sadistic. You know what I mean? You don't have compassion the way you do when you're older. Well, one of the things me and my siblings and my friends would do was, because growing up in the house that we grew up in Sammamish, Washington, back then, there were horses around. There was woods. There was cows. It was extremely rural and old growth forests of pines and alders and maples and stuff. And that was my backyard. It was just, or actually, it was every yard around. We were just surrounded by trees and so we spent a lot of time in that. And mosquitoes and slugs were a major character in the story of my childhood. I one time counted, I had hundreds of mosquito bites on my body because I'd be running around in shorts and a t-shirt for the entire summer. And where we lived, it was so damp because there was so much shade from the forest that mosquitoes were everywhere. Yeah. And you just couldn't manage now when I go to a situation like that, you got your off, you got your long sleeves, you notice when one's around, and you maybe you go home early because they're, here comes the mosquitoes. Back then there was nothing to do. We didn't even have screens on our windows. Do you know what I mean? So mosquitoes probably eating me in the middle of the night. I had spiders and centipedes crawling on my chest because not only did we live in a moist forest, but I lived in a basement of a house that was basically in a wetlands. Like my parents still live in this house. It's flooded like 4 or 5 times.
I didn't know that.
3 major times. Yeah. And so it was a moist, constantly damp, even in the summertime, it was, the soil was still moist, and the spiders and the centipedes and the mosquitoes and the what we called mosquito eaters were just all around, And like I said, I would wake up in the middle of the night with a centipede, not a spider, but a centipede on my chest. I'd be like, oh, a centipede, and get rid of it. And so the amount of slugs that were around us all the time, they would get into the house sometimes. Yeah. So they were a pest. And you'd step on them and on accident, and so one of the things that we did, because we hated slugs so much because they were everywhere, is we would pour salt on them.
Oh yeah, yeah.
And it was the weirdest thing to see because their entrails would come out of their ass, and they would move really fast because slugs, by definition, they move slowly. But you put salt on them, and somehow their guts make them move faster as it comes out of their. It's disgusting.
Oh my!
Right?
Yeah.
We would. I had model ships were big in the 70s. Like a battleship or an airplane. Before the internet, we would just make plastic models of things. And one of the things that we would do is we'd put slugs on the battleship, and then we'd put firecrackers on the battleship, and it was like World War II, right? And we would light these slugs, and and giggle as these slugs like were dissipated across the yard. I talk about this, and it's sadistic. It's awful. I mean, we never did anything to cats or because we loved cats. We
Sure.
loved dogs. We never did. I had a friend that threw a rock at a squirrel once at Woodland Park Zoo. And it's, we were he started throwing rocks at squirrels, and I kind of joined in, but there was no way you're going to hit a squirrel from 50 yards. You're not going to. And he threw a bullet and hit a squirrel directly in the head.
Oh God.
And I was terrified. I was just like, what? You hit it. You hit it. And my friend was like kind of ambivalent because he was always a little kind of different, but so I wasn't that way towards other animals, but slugs and mosquitoes. And I'll tell you one story about a mosquito. I was sitting around a summer day, bored, and I saw a mosquito flying around me, and I'd heard that you can kill a mosquito while it's sucking your own blood if you tense your muscle, because the proboscis or whatever gets stuck, and it can't stop drinking your blood, and then it'll explode.
I've heard that.
Right. So I sat there and I actually put my arm out. It landed on my arm, started sucking blood. I clenched down, and sure enough, that's what happened.
No kidding.
And I could see the back of the mosquito just becoming extremely bulbous and see-through with my own blood.
Oh wow.
And I was holding it, and I'm like, okay, you're supposed to explode at some point. Like, there's got to be a limit. And somehow it got free, or I couldn't uphold the the clenching, but it couldn't fly because it was so heavy.
Too heavy.
And it landed on my wall, and I smashed it, and blood went everywhere. Of course. Well, that does it for that disgusting episode of Psychology in Seattle.
So apparently your patron's question reminds us of our kidhood.
Yeah, how did we get on that?
Let's see.
Oh, reminding of people. How did we get to that?
Yeah, how did we get to that?
Well, anyway, she emailed back. So I said to her, that's right. So I said, do people remind me of clients? I'm similar to Bob in that it's like, yeah, kind of, but pretty peripherally. Has it impeded the therapy process? Similar to what Bob said, not for me. If I had to, I just pay a little bit more attention to my countertransference, which I do all the time anyway.
Yeah. She
emailed back, and by the way, she's romantically and sexually attracted to her male therapist. And she wrote, as I was leaving therapy on Thursday, I asked my therapist if I reminded him of anybody. He got really weird and coy and said he wasn't comfortable saying right then because I had to go. Mm. I asked him again because it made me so curious, and he refused to say. Mm-hmm. He said he needed to think about it, about how to answer the question. Mm-hmm. The next session, I brought it up. He told me that I reminded him of his aunt. And to be honest, I was immediately upset. First of all, I'm assuming his aunt is older, and this means that he obviously doesn't reciprocate feelings for me, which I already knew, but this was confirmation. We talked about it, and eventually I told him I was disappointed, and we talked through it further. He was awesome about it, as expected. Although I'm still a bit miffed over it, I'm disappointed, but it is what it is. Erotic transference sucks, though, you know? Any thoughts about that, Bob?
Yeah, that's distracting, and keep talking about it.
Yeah. Right. And what we always say is that it's a real feeling. It's not puppy love, or it's a real intense feeling, just like any other kind of erotic or romantic feelings you have towards someone in your life. So it's not something to demean or discount or dismiss. But at the same time, it is an expression of your need, in all likelihood, for someone to love you and to pay attention to you. And you found that person, and you naturally have a lot of intense feelings towards that person because you finally have someone that's meeting your needs, maybe for one of the first times in your life.
Yeah.
And all of your heart is opening up to this person, including romantic feelings and erotic feelings. And it's all kind of part of the package. When you're neglected or abused or relationally traumatized, and you find a healing human being who is there for you, consistent, not harming you, it's normal to say, well, not only for your heart and your unconscious, not, for that part of you, not only to be like, ooh, I want to talk to this person all the time. I want to tell them everything that's on my mind. I want to ask for support. I want them to hear me. I want them to see me. I want them to take care of me. And I want them to love me and to have sex with me and to be with me forever and to hold me and to take me out to dinner and to say lovey things. Like, it's all part of the package, because it's natural to go there. But anyway, so you asked your therapist. So would you do that if say you had a client that reminded you of your aunt?
Okay. And
your client at the end of the session says, so do I remind you of anyone? What would you have said?
Well, I might have punted and said, let's talk about it next time.
The similar way to the way he did.
Yeah, not to punt, not to be coy though, but to more like, that's a doorknob question. That question might have a lot of meaning to it. And I'd probably want to talk to the person about what does my answer mean to them more than how do I want to answer this question.
Yeah. Do you want to explain what a doorknob question is?
Yeah, it's when you have the courage to say the thing that it's really hard to say because you're leaving.
Yeah. Right.
Yeah.
So you might have done this, and it sounds like you would have done the same thing.
Yeah.
Yeah.
What
might you have just said, even though she did remind you of your aunt, might you have said like, no, you don't really remind me of anyone?
I might say that.
Why? But why that's lying to the client though.
Yeah, but is it necessary?
Right. And I've been going back and forth with another patron about this because I can't remember what I said. I said something like, there are some situations where I'm just going to lie essentially and just say, I mean, I don't really consider it lying. I just consider it like, well, it's not relevant and it's not important. What Rebecca Bloom would say is clients don't have the right to know things about you.
Oh, yeah.
You know what I mean? Like, just because you're a client doesn't mean you have the right to know my inner workings. You know what I mean? So, but yeah, for me, there are situations like what you're saying where I would just be like, this might trip this person up to such a degree that it's not going to be helpful, and it's not really significant, and it doesn't matter that this person reminds me of my aunt.
Now, wait, do I know that they have erotic transference?
Yeah.
When they ask the question?
Yeah, let's say that.
Oh, then I definitely would really want to get this spotlight right back on what's going on for you. Do you want me to be reminded? Is that somehow...
Would you reveal it, though?
Nah, probably not.
Right. Again, because the minefield is such, like, it happened to this. Now, I don't think this therapist did the wrong thing.
No, not at all.
But there's a risk there of just like it hurting the client's feelings, even though it's not unreasonable to say such a thing to a client, like, oh yeah, you remind me of my aunt, kind of. But it's clinically something you want to be like, well, pros and cons here. And do I think I can pull off the lie? That's always the other thing too. It's just like, is it something, because the opposite, so the risk of saying, no, you don't remind me of my aunt, is what if at some point you do say that they do remind you of your aunt? Then the client's like, well, wait, last time you said,
right.
and that could be a massive rupture right there.
Sure.
Because if your client is like, you've lied to me. But the other thing is that I think what the other patron was asking me about was, would you tell a client if you were attracted to them? So say you're just minorly attracted, or I don't know, whatever level of attraction, sexual attraction you have towards a client, and they're like, so are you sexually attracted to me?
Nope.
What you would say no.
No.
Right. So give me your justification for that.
I think it just has too much, it gets too distracting because that becomes a focus, or it could become a focus. I don't really want to talk about that. I don't want to talk about my feelings of attraction to anybody except my wife.
Yeah.
Yeah. And I don't see any relevance. I don't see any therapeutic benefit. When I have had sexual attraction to clients, usually what I do if it's distracting to me is I talk about it with, a colleague or a team.
Right.
And I remember the first time it happened to me, it scared the shit out of me. I was so scared of what that must mean. And everybody was really cool. They're like, it happens. It's okay.
Yeah.
And one guy said to me, it's just an opportunity for you to think about what's getting stirred up for you. Like, you might as well learn from it. So I did, and that was good. And but I don't see the need to reveal that kind of information, and I don't think it's useful.
So I get so many emails from people talking about scenarios where their therapist did tell them.
Huh.
And I think there's this general philosophy out there that you are supposed to tell your client about it or something.
I don't get that.
Yeah, I don't get it either. I mean, I get the, it's all about being congruent. You don't want to drive your clients crazy, with incongruence and stuff. But at the same time, it almost always goes badly for these people. They'll just be like, I feel like I'm really distracted by it now. I'm wondering, does he fantasize about me? Or do we have a chance together because I'm sexually attracted to him too, and now I realize he does for me, and like it really becomes not just a distraction, but like a destructive force to the whole premise of therapy, So I'm glad to hear you would do, because that's what I was telling this other patron. I was just like, actually, if it was an attraction, I'm pretty sure I wouldn't say anything about it. I would go to my consultants, I would go to my therapist, I would think about it, and I would manage it. And but I don't see the point in telling my client about it, and unless it's so overwhelming that. But even then, I can't imagine why. Like, I guess the only situation I can imagine where I might is if I was having to forcefully terminate a client, like in the middle of treatment or something, and I would just be like, actually, I have to tell you, like, the reason why is because I have a problem, and this is the problem.
Yeah.
And it's so. Because if it was in the middle of treatment with someone with relational traumas, it was like, well, I could say a different story of just like, well, I'm closing my practice, or I am having significant countertransference, but I'm not going to tell you what about. You know what I mean? Like, that could be a little crazy.
That would feel weird.
Yeah.
Yeah.
So I could imagine saying in a situation like that. So I've been struggling for a long time with my own issues of sexuality in regards to you, and it's all my fault, and I've given a lot of thought, and I tried to get rid of it, and I tried to consult. I got therapy, and nothing really worked, and I find that it's just impossible for me to talk to you.
It's like you're saying, I can't be the therapist you need me to be.
Right.
Not I'm getting rid of you.
Right.
Yeah.
It's like, you don't want me as your therapist. Take it from me.
Yeah.
You know what I mean? And but aside from that, I can't imagine why I would.
Has that ever happened to you?
No. Actually, I've talked about it before on the podcast. So I've done a lot of research on erotic countertransference, and this,
really,
yeah, and the statistics are that men and women, the vast majority of them report having at some point in their career erotic countertransference.
It'd be hard to not.
Yeah, but for me, I'm at one end of the spectrum. I can't remember a time where I was sexually attracted to a client. I'm sure it's maybe happened kind of, but in talking with colleagues, men and women, they have several stories off the top of their head where like, oh, there was this one person, this other person. And for me, I don't know what it is, but I have other problems. I get angry at clients. I'll get narcissistic with clients. Like, listen to me. I have the answers, or right. But when it comes to being sexually attracted to a client, like that just doesn't engage in me. Do you know what I mean?
Well, how are we defining that?
Yeah. Well, how I'm referring to it now is sort of an unwanted arousal or fantasy about a client.
I don't permit those.
Yeah, but popping into your head.
Sure, those things pop in, and I pop them back out.
Or like, so that would be what I'd be talking about. Sort of like an involuntary popping into the head or a desire to want to fantasize about a client, or
I've never had either of those.
Or, someone is wearing a sexy outfit and you're like wanting to look at it more than their face or something.
Yeah.
You know what I mean?
Right.
That just doesn't happen to me. I can think of many situations where that might have been an issue if it weren't the therapy context, but I guess I'm so hyper focused on my duty and my mode that it just doesn't enter my brain.
Yeah.
I imagine that physicians, gynecologists, heterosexual male gynecologists, or heterosexual female urologists. Urology? Is it urology, the penis doctor?
Yeah.
Or a gay female gynecologist or otherwise. That when you're at work, you're at work and you're doing work things, and this is a patient, and you have a job and you have a duty, and in another context, maybe you have different aspects of your brain that kick in, but for me, that's how it feels to me. How's it for you? I don't know if you want to talk about it.
Well, no, I'm fine to talk about it. I mean, sometimes people are beautiful. Mm-hmm. They walk in the door and there they are. They're dressed beautifully.
Right. So there's an acknowledgement of like, I bet you this person is attractive.
Yeah.
Or in another context, I'd be attracted to this person.
Oh, sure.
But that's different than actually being attracted.
Well, I mean, I guess I could say, yeah, I've been attracted to clients. Several beautiful people have walked through my door. And, it's like, that's not why we're here. I'm kind of busy with why we are here. And it's been mildly distracting from time to time, but it doesn't last. And I just wait it out, and then it goes away, and, off we go.
Yeah.
But, I got to tell you, I really like working with people. And so I'm not really interested in what they look like. I'm really interested in how they are, and they fascinate me. And I have tremendous admiration and respect for the kinds of bravery. I'm kind of busy with that.
Right, exactly. It's a matter of focus.
Yeah, focus. That's a nice way to put it.
Yeah. And if you were dating or something.
Oh, no.
And it was a date, and you're like, well, maybe we're going to have some business time later on. Do you watch Flight of the Conchords?
I've heard that one. Wednesday night.
Yeah, Wednesday night. I got my socks on. It's business time.
They're business socks.
Yeah. You're reading your book. So coy over there. You're going to get ready for about 2.5 minutes of some prime business time. God, Flight of the Conchords. I've been going occasionally when I get bored or distracted, I go to YouTube and just watch a live performance of Flight of the Conchords.
Those guys are funny.
God, I missed that show. It was only on for like 2 or 3 seasons, and it's so good. It's like the first few seasons of Arrested Development or something.
Oh, yeah.
Anyway, so that does it for that episode. Thanks for joining me, Bob.
It was nice to be here. Thank you.
And I've been saving these questions for you for a long time.
Oh, no. Okay. All right. Yeah. Well, I'll come back sooner.
Because I can't talk with Umberto about these things. He doesn't know anything about this sort of thing.
Right.
He'd be like, well, of course I'd be sexually attracted to clients.
Is your podcast different depending on who you're talking to or when you're by yourself?
Yeah, absolutely. So I gear the topics toward the situation. So there are some topics where it's like, I can't really do it with anyone else because it's a lot of me just rambling about my notes and da-da-da-da.
Yeah.
And, but when I get therapy questions, I save them for you.
Cool. Thanks.
Any updates on your life you want to talk about?
No.
No? Are you looking forward to Penn State's year? I mean, they're what do we got? Another 4 months? When they'll start playing again?
I got to tell you, I'm ambivalent about football these days. It's just so violent.
It's violent, yeah. Yeah, it's really hard, knowing what we know now about, ongoing traumatic brain injury.
Right.
It's, I still watch it and still love it.
Oh, yeah.
But when a whiteout is doing a crossing pattern around the place where a linebacker or a strong safety is going to be, like, I am cringing. I'm just like, oh God.
Yeah.
Just,
Yeah.
just arms only.
Yeah.
Just tackle with the arms and the chest, not your head.
Don't use your head.
And you see that stuff. And I used to do it too.
Right.
I used to lead with my head. One year when I played football, I played with a neck brace kind of thing on my shoulder pads. People don't wear them anymore, but back in the day that you'd wear these neck things. And basically what it did was when you hit someone with your head, your helmet would hit the pad, and then the pad would hit your shoulder pads, and your shoulder pads would hit your shoulder. So it kept your neck from compressing, essentially. Right. And it effectively, it was extending your shoulders into the top of your head, if that makes any sense.
Yeah, it makes sense.
So when you hit something, you didn't break your neck as easily. And I had so many neck problems in football. Like I remember I had I just sit out a couple games actually in my senior year because I had a pinched nerve down my arm.
Oh, yuck.
And and of course you talk to the physician and they're like, yeah, maybe a pinched nerve, like maybe take a couple weeks off and come back, People would have concussions in the middle of a game and come back in later. Yeah. I had concussions in the middle of a game. I remember one time I was, I played running back and linebacker. I got hit so hard in the head because that's one thing that you don't really. Did you play football?
Oh, hell no. Playing
football, they make it. They got pads on and everything. It makes it look like it's not painful, but every hit hurts. Those pads just distribute the pain to other parts, more global parts of your body, to the point where people frequently, as a congratulatory thing, will hit you in the head.
Oh, yeah.
They'll hit you in the head with the helmet. Imagine if I just went up to your head right now, Bob, and just slapped your skull as hard as I could.
Right.
It's going to hurt, right?
Oh, yeah.
Well, when people hit you in the helmet, it hurts. Really? It just distributes the pain more globally towards your entire skull, not just one spot. And I'd be like, stop slapping my head.
Yeah.
Like, slap my ass, that's fine.
Sure.
My shoulders, but that can hurt too. Because I had a coach that he would get so angry at halftime, he would just start hitting people on the shoulder pads, and it hurt.
Yeah.
And he was a strong dude.
Yeah.
He got so angry one time, he punched his own clipboard, and it shattered in a, I don't know.
Those are hard to break.
Yeah, imagine punching a clipboard and shattering it into 100 pieces. That's how angry he was.
Oh my God.
Very motivating. Anyway, so I would, every time. So playing running back is one of the most brutal positions you can play. Because when you're a lineman, you're absolutely in the trenches. You're absolutely grinding it out. But when you get that ball as a running, especially in, when you're playing Pee Wee and high school football, it's pretty much run. It's every play is a run. You don't have a good passing finesse at that point. And every time you get hurt, every time you get hit, it's like a 50% chance that it is going to be painful. Some tackles, it would just sort of glance off you, sort of fall down. But when someone just hits you straight on, I mean, I have a broken bone in my back currently.
Oh, geez.
And actually I have a slipped disc because of it.
Oh, yeah.
Not because I was hit in the back, but because me and another guy hit each other so hard. He was the running back, and it was a sweep. And I was the middle linebacker, and I sprinted out to the sideline to catch him. And we both turned at the same time and squared off and hit each other in the helmet.
Oh.
As hard, and he was shorter and stouter than I was.
Yeah.
And we hit each other so hard that both of our momentum canceled each other out. And so we were running at each other.
Stopped.
Boom. But my back snapped back so fast that it broke my back. But it's a bone that you don't immediately notice.
Yeah.
Anyway, so so when I watch football, everything hurts, and I just think about all the opioids that they must be on,
yeah.
or the marijuana, or
Yeah.
whatever they're doing, stimulants or whatever they're doing to kind of keep that up, for sure. But man, do I love watching football. and they keep adding more and more rules and more protocols to try to protect the players.
Yeah.
Like they are much more strict with the targeting calls that even 5 years ago they never would have called. Particularly like 20 years ago. I mean, hits today that they throw a flag at pretty readily. In the past, you'd be like, yeah,
good hit.
Yeah. And now you're like, oh, you don't lead with the head, because that they called it spearing when I was a kid. It's always been illegal to lead with your head.
Yeah.
For reasons for both players.
Right.
But they never upheld it. I don't remember spearing ever being called when I was a kid. One time, I was playing defense, and this running back was running with the ball, and I speared a guy with my head, but I was up high, and a friend of mine who's short speared him low.
Oh wow!
And we were coming from opposite directions.
Right.
And that boy, his leg snapped, and he was screaming so loudly.
Oh God!
An ambulance had to come out on the field and pick him up.
Oh, poor guy.
And you just think about stuff like that. You're just like, football is so violent.
Yeah.
It's so awful.
Yeah.
But it's so. Do you find yourself enjoying it less because of that?
Yeah. It's a tremendous skill, and it's, fun to watch, but it's just like, I just feel like these people are putting themselves in harm's way, and I don't know if I want to support that.
Yeah. Well, I'm just supportive of more rules around.
Yeah.
Because you can do it. It's kind of a cultural thing. You work it into the training.
Yeah.
Where, because the thing is what's happening right now is you have a bunch of pro players who were indoctrinated into a culture where that wasn't a problem.
Right.
And would even encourage it.
Right.
So if I'm guessing they are, starting with no targeting, no spearing as a child, by the time you get older, it just becomes muscle memory.
Right.
Because I see these guys, safeties, Cam Chancellor, these kinds of guys, I see them tackling. I'm like, yeah, that's how they taught us to tackle.
Right.
You throw your body into it. That's, and your head happens to be a part of that.
Yeah.
And so I'm hopeful that they can somehow reduce the injuries. And,
right.
I don't know, give the players more time to rest maybe, or better helmet technology. I don't know.
Yeah.
It's sort of like with boxing. It's like you can't really, maybe there's no way around it.
I think there's no way around it.
Yeah.
I mean, you can maybe minimize, but you're only going to get so much return.
But I was listening to a podcast where they were interviewing a guy who, I think he had died or had killed himself or something, a pro football player. I can't remember. And they were talking to his family, and he died like in his 30s or 40s or something. And they were talking to his family, and although they were very upset about it, they were, the podcasters, interviewers, it might have been This American Life, they were asking them about, how do you feel about the whole thing? And they're like, well, we don't like to have lost him, but we know that he wouldn't have done it any other way because he loved the game.
Mm-hmm.
And he loved playing for the NFL.
Mm-hmm.
And I think he would have thought it was worth it, which I think is an interesting thing, because we automatically, like from a certain perspective, you're just like, well, of course we have to get rid of football, and of course it's harmful to the players, and we need to protect the players, so let's get rid of football. But to some people, it's worth it to them. Mm-hmm. Going to Mars, there are people who have already signed up to say, I'll fly to Mars. Well, that's a death trip, in all likelihood. And there are certain sort of plans. It's just like, you're not coming back. And in all likelihood, you're going to die at some point, early.
Yeah.
And there are people who sign up for that. So there are some situations where people are like, look, I don't care if this shaves off 20 years, 40 years of my life.
Right.
I want to do this.
Yeah.
And I'm willing to roll the dice, I guess, is the thing. Any thoughts on that?
There are plenty of people that are willing to roll the dice for lots of things.
Right.
And, it's not for us to decide,
Right.
What you should or shouldn't do with your time.
Right. So that's another thing. It's like when I watch boxing or UFC or something, I assume that these people know what they're getting into, right? Because it's been well known that your brain doesn't do well under those conditions, or your joints in the UFC don't do well. I have a friend, Ivan Saliveri, who was big into UFC. He actually has a gym downtown Seattle, which you can take classes from. You can actually, did you know that in Seattle you can, how there's gyms, or you can take like karate classes or something. You can take UFC classes.
Jeez.
Or what do you call it?
Mixed martial arts.
Mixed martial arts classes. Yeah. And he's had to replace both of his hips, and he's our age.
Oh wow.
And
we're not that old,
right? But with all the kicking and the jumping and the rolling around, like his hips just had enough.
Yeah.
And so
I think what gets tricky about this though, is that if you're growing up poor or disadvantaged,
absolutely,
your choice is different than if you're growing up, privileged, or the choice is really is different, because the meaning of the thing and the value of the thing is really different.
Absolutely.
So that it gets a little bit,
absolutely
blurry.
Yeah, a lot of the people who are, willing to do those kinds of things do come from marginalized groups, and might not have another way to find the meaning in life that they're seeking or something, for sure. So all that has to be looked at too.
Right.
So I forgot I wanted to talk another thing about Irvin Yalom.
Oh.
In his memoir,
right,
he talks about his lifelong love of gambling and playing cards.
Really?
Yeah.
Who knew?
What
does he play?
Poker. But he plays everything. So when he was a kid, they're in New York or Philadelphia? Baltimore. No, D.C. Well, D.C., Baltimore.
Yeah.
Specifically D.C.
D.C., okay.
His parents had a grocery store. They were immigrants from Russia, I believe.
Yeah.
But originally from Polish ancestry.
Yeah.
And they were frequent, customers come in, and he would work in the store and he'd meet customers. And one of the customers was some sort of bookie or some kind, and had like a ton of money, and he was like, ooh. And then in the neighborhood there was like a numbers sort of lottery game you could play that was run by an unofficial situation.
Right.
And then he developed his own numbers game at school.
No shit.
And it was based on baseball, on like you can bet on 3 players getting 2 hits in a particular game. And the chance of 3 players getting 2 hits, 2 on bases, or 2 hits, is pretty slim.
Yeah.
He worked it out. It's like, it's 1 in 20. And he would give people a 1 in 15. And so he would make money, off the deal. And so he's a kid, and he's running this kind of racket and making money. And then he, would gamble all sorts of things, like just, on baseball games, or, and then he started playing poker, and he had like a regular poker group. And as he aged into his 70s and 80s, he stopped being able to, he says, there's a lot of grief and loss about getting old. You can't, I can't run marathons, or I can't run long distance anymore. I can't do this. I can't do that. But the one that really hurts the most is I can't play poker anymore with my friends, which I'm trying to figure out why. But anyway, that's what he's saying. And actually, when I asked him about this, I think he started to cry a little bit.
Oh.
When I said about his love of gambling and poker, I think it reminded him of that loss, and I think he started to cry.
Oh.
But so he's at the point now where he doesn't do any official gambling, so he ropes his wife into gambling. So he talks about this one anecdote in which they're going to a party, and she's trying to convince him to wear a tie. And he's like, okay, fine, I'll wear the tie, but I'll bet you $20 no one at this event is wearing a tie except for me. And she's like, okay, I'll bet you $20. And so he's like, he still loves to gamble. He just has this thing. Any thoughts about that? Because you and I like love to play cards, love to gamble.
I've changed.
But we used to.
Oh, love cards. I still love cards.
Yeah.
Yeah. Any thoughts about that? I'm glad he's found a way to have some passion.
But I asked him if he thought there was a thing about therapists and gambling.
Oh, do you think there is? I never thought about it.
I don't think so, but I wonder. Or I wonder if there's a particular kind of therapist that is attracted to gambling.
Jeez, I never. What do you think? Is there psychology there?
Well, I was talking to someone else about this. They're like, well, reading people,
right,
playing poker. But to me, I'm not the sort of poker player that tries to read people.
I don't.
Yeah, I don't care. I'm more. It's more the rush.
Yeah,
it's more like the what's going to happen this time.
Right. Can I pull off a bluff or?
Yeah.
Yeah.
I've got money on the line.
Right.
Or I know I've got the nuts, and no one else knows.
Right.
Oh my God,
right.
heart a pounding. Or, oh my God, I just put like $100 bet on black.
Yeah.
Yeah. I've thought about this over the years. It's an artificial way to create drama in your life.
Right.
You either win big or you lose big.
Right.
It's like that line from
Some Kind of Wonderful.
Some Kind of Wonderful that we always say. It's like, how do you win big?
What do you got to do to win big?
What do you got to do to win big?
You got to lose big. What are we doing? We're losing big.
We're losing big. And you and I would say that all the time. But yeah. I mean, we went through a phase where we like to go bowling every now and then.
Oh yeah.
And then that quickly evolved into bowling for dollars.
Yeah.
And that became a serious thing.
Do you know I have a joint savings account with Michael where we've kept the bowling for dollars money?
What is that for? What?
So the first one of us that rolls 260 or better gets the dough.
How much is in there?
$255.
260 is impossible.
Well,
how high did you guys ever get?
My high is 256, but that's league, and league doesn't count.
256?
Yeah.
That's incredible.
Yeah, I had a good night. Yeah.
That's incredible. Wow. No matter how many times I go bowling, I'm still as bad as I was like probably the 5th time I ever went bowling. I've gone bowling probably maybe 50 times in my life, maybe more. And every time I bowl, it's like I'm good for like 3 or 4 spares and strikes.
Yeah.
And then maybe even a gutter ball in there.
Oh, sure.
And it's like, anywhere from like a score of 85 to 140 or something. If I got 140, I'd be like, well, I think one time I got like 160 or 70 or something. And, but yeah, did you get good doing those? Is that when you got good, or were you always good at bowling?
Bowling?
Yeah.
Oh, I was always okay at bowling, and I got good at it since I started league 3 years ago.
Interesting. Yeah, because I remember when we started out playing late night bowling in Ballard and stuff.
Sunset Lanes.
All of us were terrible. Yeah. All of us were like me, where it was if you broke 100, it was a good night.
Right.
And then over time, I would go bowling with you guys every now and then, and I was like, man, you guys are now putting spins on the ball.
Yeah, totally.
You're trying to curve it, and I'm like, what's going on here? I was like, man, you bought your own balls.
Yeah, your own ball. That's it, man.
Michael had a ball that said Sparky on it.
Yeah, he still has it.
And I was like, man, you guys are taking it way too seriously. That actually, I loved, and I still do, playing cards with you guys, but that actually became a similar thing with when it came to poker. Because when we would play poker, you, me, Mike, Beth, Todd,
right,
and what was that other guy's name who moved away?
Aaron.
Well, it was Aaron. There was Will, but then there's that other guy that had that wife that everyone hated.
Oh, Keith.
Keith, yeah. They're not together still, are they? No. Just in the off chance.
Is he listening in? Keith, hi, if you're listening.
Yeah. But I remember we would watch Sonics games.
Oh, yeah.
This is like 97, 98.
Right.
And we would play poker. And the games we would play would be 5-card draw, 7-card stud, Jaworski high-low.
Right.
We would play, the general games that my dad taught me to play.
Right.
And then I started introducing Bloody Sevens, which is like a bluff. If you ever played, is it Bluff? I think the game is called.
I don't know.
Guts is the game. If anyone ever played Guts,
oh yeah.
This is Guts, but like more likelihood you're going to have a good hand because there's like wild cards. But anyway, people would lose hundreds of dollars playing that game. It was so awful. But anyway, so we'd play that game, and then at some point, someone started introducing Texas Hold'em.
Oh yeah.
And Omaha and other kinds of Hold'em games.
Right.
And it was like, okay, every 10th game, because I love playing summon card stud. That's just 2 down, 4 up, 1 down. It's just like a beautiful game. There's a lot of drama that happens in that situation. Yeah. There's a lot of chances of things happening. Throw a wild card in there, one-eyed jacks, and like it gets exciting.
Yeah.
And random enough that like you could win any hand, really.
Any hand.
You just don't really know what's going to happen.
You don't.
When we started introducing, and then Omaha was fun because again, it's so random that you can't. There's no real system to that game. But Texas Hold'em is so tiny of a premise that it reduces the entire game to this very small sliver of possibilities.
Yeah.
Like with Texas Hold'em, pretty much from the very first 2 cards you get, if you should stay in or out.
Oh, I should hope so.
Right. But when it comes to 7-card stud or 5-card draw, you have no idea. People stay in. They keep betting, and they also don't bet a lot of money because they're just like, well, God knows what's going to happen the next round we go around.
Right.
And so with Texas Hold'em, the thing I didn't like about it was like, we'd have 8 people sitting around the table, and like from the first 2 cards, like maybe only 2 people would stay in. And I'm like, this game's kind of dumb. Like, I don't want to sit around and wait for this whole thing to happen.
Yeah,
like, I want to play.
Yeah.
I want everyone to play.
Right.
I like that whole thing where it's like, you're going around the table and you're giving your card out and you're seeing what everyone's getting. You're just like, oh, someone's doubled up, and it's just like, it's fun. It's a group activity. And the shift that happened when I started playing, when I occasionally play with you guys, was with Hold'em. It became a serious matter.
Yeah.
It became like, I'm trying to win now.
Right.
Whereas back in the day, you tried to win, but you just knew like, well, God knows what's going to happen. You know what I mean? And if I lose, it's fine.
We paid for very low stakes.
Right.
And the point wasn't to win money. The point was, the point is to win money, but we weren't playing for sums of money that anybody actually mattered.
No, I remember we would buy in for $5,
$5,
and that would last us the whole night.
Yeah, except for Bish, who would write individual $1 checks.
That's hilarious. So by the time we started playing Hold'em, we were in for $20, $40, and it became more of a thing.
Which is why I stopped playing.
Oh, really?
Yeah.
So what was your journey with that? Because I wasn't really hanging out with you guys as much during that time.
It got to be that it wasn't fun. I didn't like how I felt, and I didn't like how I acted, and so it just wasn't fun anymore. So I just stopped playing.
Yeah.
It was too serious.
I remember that happening with all of us, even with the $5 thing.
Yeah.
But it was like tolerable somehow. There was always someone who would freak out.
Yeah.
Who would just be like, God fucking damn it.
Right.
You get legitimately angry at how absurd it is that you can't win a hand.
Right.
But yeah, definitely when Hold'em came around, it became much more about like, it felt like if you lost, you were legitimately a bad person. Like you're a chump. You don't know how to play the game.
Right.
I remember it was. I think I told you this before, but it was particularly noticeable to me because I would only play once a year with you guys.
Right.
And so as you guys were getting more serious, I wasn't. And so I'd be like, okay, fine, we're playing Hold'em, whatever. And because I play once a year and I didn't really care, I stayed in on almost every single hand. I didn't care if I had terrible cards, and I didn't care if I lost $1 here and there. And I stayed in on this one hand and won it. But my card, I won on the what's the
river,
the flop, the river.
Yeah.
The last card that you see that the dealer shows. I won like on a straight. I filled an inside straight or something.
Right.
And people at the table were legitimately angry at me. They're like, "Why did you stay in?
Stay in, right?
Like that's bullshit."
We pulled a Phil Hellmuth on you.
And I'm like, "It's called poker.
Poker.
It's called gambling.
Sure.
Like I made a choice.
Yeah.
And the chance of me winning was slim, but I won.
Yeah.
So fuck off.
Yeah.
Like and plus this is for fun.
Right.
But it was like legitimately like a transgression.
Yeah, I remember.
It was something do you remember that moment?
I don't remember that particular hand. I just remember that time.
Yeah. And about like how that attitude gets it. Like when I
didn't like feeling that way, Kirk.
Yeah.
I didn't like feeling that serious and irritated. It's like, why?
Yeah.
It's not fun. So I
Right.
stopped. Go ahead.
Yeah. I felt similar about golf. We all got into golf for a while.
For a while.
And in the beginning, it was like, oh my God, I'm so terrible at golf.
Sure.
And then I got a little better. I'm like, oh, I'm getting a little better. This is kind of fun. And then I would have a bad day and my mood would just plummet.
Like, what's the point?
Yeah. It would put me in a bad mood the whole week. I'd just be like, I can't believe
Right.
that I put one into the woods like 3 times in one hole.
Right.
How does that happen?
Right.
How do I drive a ball, 300 yards straight one moment? Is 300 yards far? That's far, right?
300?
Yeah.
Yeah, that's like pro far.
Okay, so 200. I feel like some of you guys would drive.
Hunter can drive that far.
Oh.
My best drive's probably like 220.
Okay. I mean, it got so bad that I started driving with my 2-iron. I don't know if you remember that.
Oh, you don't mean driving around in your car with your 2-iron always ready. You mean driving with your 2-iron. If I play golf, and I don't play golf much anymore, I don't go any higher than the 7-iron. I play everything with a 7-iron.
Really?
Oh, yeah.
Wow.
For this reason.
You drive with a 7-iron.
Oh, yeah.
Off on a par 5.
Yeah, on a par 5. You're still going to get there in 3. It's going to get there in 3 whether I hook it into the woods or hit a safe 7-iron.
Right.
And safe is relative because I shank those into the woods too.
Right. That's funny. Yeah. People would laugh at me because I would drive with an iron.
Yeah.
And I'm just like, well, woods, it's a totally different stick. It's much longer.
Yeah.
And it's a totally different technique of swing too, because you're further out and the weight is different.
Right.
And I'm just like, why would I want to take that chance?
Yeah.
I'm still going to shank it into the woods. But anyway, yeah. So I stopped golfing because I cared so much.
Yeah.
And I'm like, it's no longer fun.
Now the best thing about golf is the beer.
Yeah. And being with your buds and being outside and I don't know, just the fun of it all.
Yeah.
Similar to poker, right?
Well, ideally, yeah.
Yeah. So how'd we get on that topic?
Irv likes to gamble.
All right. So I thought that was interesting.
I'm surprised.
You're right. He doesn't fit the stereotype.
The picture in my head.
Yeah.
The idealized picture in my head.
Yeah.
Yeah.
But he loved gambling more than we loved gambling.
Yeah, sounds like it.
Yeah.
Shit, you're running a numbers game when you're in high school. Holy cow.
Yeah. But like what a smart dude to run a 20-1 odds gig and give 15 to 1. And, over time, you're going to win. That's like a job.
Yeah.
And as a bettor, you're going to be like, well, yeah, I know it's fun. I'll put 50 cents on that. If I get 15 to 1, like, whoa,
Yeah.
Yeah, he talks about in his book how he still gets emails from his poker friends inviting him, even though they know he's not going to come. But he says, well, I think they just send me the emails out of courtesy because they don't want to make me feel like I'm not invited. But every time I get that email, it hurts.
Do you think he's having some kind of cognitive problem?
A little.
Oh, poor guy.
A little, yes. But not like severe.
Yeah.
But like he was talking, when I interviewed him, he talked about how his because of his memory issues, he can only write short stories. He wants to write novels, but he says you have to keep too much in your head.
Yeah.
So he is going to stick to short stories. And his memoir is kind of set up like that because each chapter is on a different topic, and each chapter is like 5-6 pages or something. So I was wondering if that's why he organized it that way.
Choice, yeah.
But yeah, maybe that's why. Maybe it wasn't because it was energy, but because it was memory. Or no, his memory and eyesight. That's what he said. He says he can't see the cards, so he ends up staying in when he shouldn't, or something like that. I think that's what he said.
Yeah.
Anyway, well, thanks for joining me, Bob.
Pleasure to be here.
Take care of yourself out there, because
you deserve it.